When Australia lifted its remaining COVID restrictions last month, health experts warned us that the pandemic wasn't over. But now case numbers are surging again as new, potentially more dangerous variants take hold. Here's the host of the Health Report on RN, Dr Norman Swan.
Nationally, 11% increase week on week, and 30% increase in deaths, although that's off a very low base. So we're on again, and wastewater and PCR testing is suggesting that we're experiencing the variants that they're experiencing overseas. XBB variant, which is, they're all part of the Omicron family. Which is this one is circulating in Southeast Asia, Singapore, Japan. We've got that one, and we've also got traces of one called BQ1 or BQ1.1.
We used to be very familiar with all these variants, aren't we? Or we were. What's happening in terms of states and territories actually tracking case numbers and also people reporting that they contracted COVID?
We're only tracking really according to people coming forward for PCR testing or willing to report positive RAT tests, rapid antigen tests, and and the data collections all over the shop. You know, different states are doing it in different ways, so it's quite hard to bring all that data together. But it's clear that we are seeing the beginning of a surge, and this is a global surge. It's happening overseas as well. So unfortunately, this virus is not yet seasonal. It's like BA5 happened around the world. This seems to be happening around the world, and these variants are immune evasive. They're evading the immune system to a significant extent. Natural infection and vaccine.
And vaccine.
Yeah. The question is, so because they're part of the Omicron family, the experts believe these are not necessarily going to be more virulent viruses, but they are more vaccine evasive. So we've got a couple of problems here. One is, even with BA5, we had 13,000 deaths, at least, in Australia in the first 6 or 7 months of this year. So we get another surge, then we're going to see more deaths. And the problem with the immune evasion is made worse by the fact that we are under-immunised. We've said it before in the show, 28% of Australians who are eligible have not even had the third dose. They could be a year or more since their second dose, almost no protection against infection, and declining protection against severe disease. And on top of that, these new variants will also whittle away at the severe disease protection of the vaccine. Not a lot, but just a little, but enough to make a difference. And the irony, and that's 5 million Australians under-immunised at least. So the irony is that if you've had your third dose, you have a third of the risk of going into hospital, and if you've had a fourth dose, it's a 30th of a risk. I mean, it's a tiny risk of going to hospital if you had your fourth dose. Even with all the immune evasion, there is a significant benefit from having that. And given that we're not wearing masks, we have no mandatory isolation, testing's gone to pot, really has gone to pot, then vaccination is all we've got, and we are under-immunised. That's the worry as we see this new surge, and we will see hospitalisations and we will see deaths, unfortunately.
I have to leave it there. Norman, thank you. More on the Health Report on RN at 5:30.
Next week I'll have better news, I hope.
Let's hope so. Thank you.